Hey, what brings you in today to labor and delivery? Okay, your pelvis hurts. Ugh, especially when you put on your pants. Ugh, it is absolutely the worst. Okay, first off, have you talked with your provider about this? No, it just started and you thought maybe you were in labor. That totally makes sense. Well, let me get my pelvic model out here. Okay, so your baby is here in your pelvis, putting a lot of pressure. And as she puts pressure on, this guy is starting to expand. And sometimes these edges of the pelvis get a little too far apart. And when you try and move legs, as you can imagine, it puts a lot of stress on this part of your pelvis. So that's usually what's happening. Of course, we're going to check your baby. We're going to check everything else. But sometimes it helps to have that model and see what's happening and why putting your pants on is one of the most miserable parts of your day. Yeah. Okay, one thing that I learned from physical therapy is that I could sit on my bed to put my pants on. And honestly, I needed physical therapy to tell me that because that was not something I was inducing on my own. I just thought I had to be miserable. Yeah, physical therapy is something you can get during pregnancy. So talk with your provider, ask them if there's something you can do. Sometimes you can strengthen your ligaments. Sometimes it's happening for another reason. And really a physical therapist is the best person to diagnose that because your provider is really just used to delivering babies. But who doesn't love a little time with a pelvis model?